Osteonecrosis or avascular necrosis AVN. Osteonecrosis is bone death caused by poor blood supply. It is most common in the hip and shoulder but can affect other large joints such as the knee, elbow, wrist, and ankle. Avascular necrosis is also known as bone infarction, ischemic bone necrosis AVN, aseptic necrosis. Causes of AVN. Osteonecrosis occurs when part of the bone does not get blood flow and dies. After a while, the bone can collapse. If osteonecrosis is not treated, the joint deteriorates, leading to severe arthritis. Osteonecrosis can be caused by disease or by severe trauma, such as a fracture or dislocation, that affects the blood supply to the bone. Osteonecrosis can also occur without trauma or disease. This is called idiopathic, meaning it occurs without any known cause. Possible causes: using oral or intravenous steroids, excessive alcohol use, sickle cell disease, dislocation or fractures around a joint, clotting disorders, HIV or taking HIV drugs, radiation therapy or chemotherapy, Gaucher disease in which harmful substances build up in certain organs in the bones,
and remaining half will be
systemic
injected
lupus
to the lateral
erythematosus,
infrapatellar
an
fossa.
autoimmune disease in which the body's immune
there is no
system
resistance.
mistakenly attacks
Very
healthy
easily we have
tissues such as
injected
the skin, joints,
50%
and
of the
certain
content
organs.
into the medial
Leg
infrapatellar
calf
fossa.
Perthes disease,
And now we are
childhood
injecting
disease
inside.
in which the thigh bone in the hip doesn't get enough blood, causing the bone to die. Decompression sickness from a lot of deep sea diving. When osteonecrosis occurs in the shoulder joint, it is usually due to long-term treatment with steroids, a history of trauma to the shoulder, or the person has sickle cell disease. Symptoms. There are no symptoms in the early stages. As bone damage worsens, you may have the following symptoms. Pain in the joint that may increase over time and become severe if the bone collapses. Pain that occurs even at rest. Limited range of motion. Groin pain, if the hip joint is affected. Limping, if the condition occurs in the leg. Difficulty with overhead movement, if the shoulder joint is affected. Worsening arthritic symptoms in the joint when the condition deteriorates. Diagnostic exams and tests. We do a physical exam to find out if you have any diseases or conditions that may affect your bones. You will be asked about your symptoms and medical history. Be sure to let us know about any medicines or vitamin supplements you are taking, even over-the-counter medicine. After the exam, we will advise one or more of the following tests: X-ray, MRI, bone scan, CT scan. Treatment. If we know the cause of osteonecrosis, part of the treatment will be aimed at the underlying condition. For example, if a blood clotting disorder is the cause, treatment will consist, in part, of clot dissolving medicine. If the condition is caught early, you will take pain relievers and limit use of the affected area. This may include using crutches if your hip, knee, or ankle is affected. You may need to do range of motion exercises. Prolotherapy, PRP and trigger point injection therapy provides promising results in avascular necrosis irrespective of its stage. It slows down progress of disease and arrests the necrosis process. In early stage of disease, if prolotherapy is started, improvement in bony structure is visible in many patients. Non-surgical treatment can often slow the progression of osteonecrosis, but most people will need surgery. Surgical options include a bone graft along with its blood supply, vascularized bone graft. Removing part of the inside of the bone, core decompression, to relieve pressure and allow new blood vessels to form. Cutting the bone and changing its alignment to relieve stress on the bone or joint, osteotomy. Replacing the deteriorated part with a donor osteochondral allograft. Total joint replacement. For more information and treatment, contact Dr. Dhanduk's Ortho Solution, way to pain-free life. Call or WhatsApp on 8856860463. https://wa.me/918856860463